Miriam, I work for People's Medical Relief, and I've been doing medical response out here in the Rockaways and in Coney Island, mostly here, since November 1st. What a lot of the government response to the crisis here isn't recognizing is that this community was in crisis before the storm in terms of access to health care.
Right.
There's a lot of people here who are uninsured. There's real lack of access to medical care. And then after the storm, when that got even worse, not only did people's access to health care get worse, but also there are specific health crises related to the storm that are not really being addressed. And one of those is there are a bunch of things affecting people's respiratory health right now. Mm-hmm. Mold is one, and the government is aware of mold, but they're not doing all of the right things to combat it. Okay. They're not getting out enough protective gear to people. All they've given out are N95 masks, which are not adequate for people who are doing actual mold cleanup. And when we asked them if they could provide pediatric masks for kids who were living in homes that were contaminated by mold, they told us, the Department of Health told us, I would strongly urge you to encourage people with children and infants not to be in those areas. So that was their response there. So they're not protecting people enough. They're not helping people get mold out of their house enough. They're saying people should get professional help to deal with it, but obviously not everyone can do that. Very not good. So there's that. The other issues that are causing respiratory problems are there's dust and debris from demolitions in the air, and there's also the cold. And the cold is a huge problem for people with pre-existing respiratory conditions, especially asthma. And that situation is just being exacerbated by the fact that so many people don't have heat in their homes still. And there's just so many problems being caused by that. People will use all kinds of unsafe methods to heat their homes, some of which can kill. People are doing things to heat their homes that lead to carbon monoxide poisoning. Or to fires, things like that. So that's the issue with respiratory illnesses. There's also pretty clear evidence, I would say, very, very solid evidence of contamination in the water.
Wow. Okay.
The city has definitively said that there is no contamination in the water, and NYCHA has decided not to do any testings in any of the NYCHA housing. But we've just been doing just door-to-door canvassing, because we have found a lot of people are coming into our clinics saying, I've been having skin problems every time I take a shower, my kids have been having skin problems, my water smells weird, my water looks weird, all this stuff. So we went door-to-door in 14 buildings today, and we found that a lot of people were reporting bad smells, visible contamination, and stomach aches, vomiting, diarrhea, and skin reactions from coming from the water. So it is really, really essential that that good systematic testing be done on that water, and that people be given, that the problem be fixed. At this point, people are still drinking bottled water in NYCHA housing because they don't trust the tap water, and I wouldn't trust it either.